Over 40% of cancer survivors in the United States experience what's called financial toxicity. In this video, I'll be talking about what financial toxicity is, what it means, the importance of financial toxicity, some of the causes, and then I'll end with some resources. So what I'm going to say now applies to the United States, where we have a lot of detail and information about financial toxicity. If you are watching in another part of the world, it's very likely that some of these things I'll be talking about are familiar and some may be unfamiliar. The key thing to know is that financial toxicity has nothing to do with insurance. It has nothing to do with what you've done wrong. Financial toxicity is a sign that the system has failed you. What do we even mean when we talk about financial toxicity? We're not just talking about medical bills. We're not just talking about what your insurance covers and doesn't. We're talking about the entire cost and financial burden to you because of your cancer treatment. Everything from the day you're diagnosed to all your survivorship care and management of symptoms long term. Financial toxicity is things that are out of pocket for you, whether it's co-pays or co-insurance. It's all that time waiting for prior authorization and then being told that even though your insurance company authorized the treatment, they're not going to cover it. It's the surprise bills that catch you off guard after you have a procedure that is not elective. Something you didn't want to have. You didn't want to have cancer, and you certainly didn't want to have this bill. Financial toxicity leads to anxiety, to depression, to problems with sleep, to anger and frustration and feeling alone. This is the thing. Financial toxicity occurs in almost half of people with cancer, and probably even more than that. It's probably everybody suffers to some extent, but doesn't meet the threshold for financial toxicity. This is the thing. We know about it. Physicians and the healthcare system know about it, but we don't always treat it or prevent it or inform you up front because we don't know. So we don't know what your copay will be. We don't know if your insurance is going to cover something. For a private insurance company, they actually have dozens and dozens of health insurance products. So you may have insurance through a private insurance company, but you will have one of 40 or 50 or even more insurance products that cover different things from somebody who lives next door to you with the exact same insurance. Your medical team also knows that people don't always want to ask questions or answer questions about financial concerns, financial hardship, things like food insecurity, things like housing insecurity, things like travel problems. Patients actually feel that it's a marker on them, that it's stigmatizing, so they don't always want to tell their doctors that they're struggling financially. We do know, however, from research that has been done, is that patients actually do want to be asked, if not by their physician, by somebody else, whether it's the front desk staff or by a financial navigator in the practice where they're getting their care, or by a nurse or a social worker. We do know that they want to be asked, and they want to be asked often. So if you're asked, are you having problems paying your bills, or are you having problems meeting some of these non-medical needs in your life, and you're asked more than you would like to be, just know that the research actually indicates that the majority of patients and their families want to be asked early and often. We can intervene, but not if we don't know, and certainly we won't know if we don't ask. So there's a lot of work we need to do as a system to improve what's covered and to improve your awareness of what will be coming in terms of financial toxicity for you. We are a work in progress, but the key message is this is not your fault. It's the failure of a system. Nobody knows that they're going to get cancer or can even know what to plan for. Very few people can actually save for 6 months take-home pay, which doesn't even cover the costs of care. So even if you've done everything you should and you have 6 months saved away, It doesn't mean it's going to cover the cost of care. I'm not saying this to make you anxious, but actually to help you feel seen and a little more prepared. Okay, so that's the hard news. That's sort of the facts and the cost of financial toxicity. What are the resources available to you? There are 4 nonprofit organizations I'd like to tell you about in the U.S. The first is the Patient Advocate Foundation. The Patient Advocate Foundation is a nonprofit that specializes in helping people navigate through the financial burdens of receiving care for complex medical conditions. I know the people at the Patient Advocate Foundation. These are some of the finest people I've known. The second group I'd like to tell you about is the Pink Fund, specifically for people who were working at the time of diagnosis and for people with breast cancer. The Pink Fund can help you if you're struggling to pay for costs of care after a diagnosis of breast cancer. The Health Well Foundation is the third nonprofit I wanted to mention. And this foundation helps people cover the costs of medication and also the cost of insurance premiums. It's hard to cover your insurance premiums if you're not able to work, or if you've lost your job, or if you are somewhere in between jobs. Finally, cancer care covers childcare costs, transportation, and counseling costs for people with cancer. So there are 4 nonprofits. The next thing I'd like to talk about is assistance from pharmaceutical companies. Many pharmaceutical companies will offer medications and other assistance to people who are being treated with their medications. It's really important to let your medical team know if you're going to have a hard time covering the cost of treatment. Now, I will have to say that financial assistance from pharmaceutical companies is pretty controversial. So you may hear some people talking ill of these resources for reasons I won't go into here, but you can probably imagine some of the objections. But I will say that when you're facing costs of care in your face, knowing that you have this available to you can be a truly helpful resource. What about transportation and lodging? The American Cancer Society has a wealth of resources. This is another nonprofit organization. They offer help for getting rides to appointments. They can cover gas if your physician fills out a form saying, just verifying that you need treatment covered. They also provide lodging through the Hope Lodge. There are Hope Lodges all over this country in the United States that are supported by the American Cancer Society, and I cannot speak more highly of both this organization and the Hope Lodges around the country. This is truly a place to continue getting care, and your family can stay nearby. If, for example, you're getting 6 weeks of radiation therapy, your family can stay there, and you can too, while you're getting care. 2 other groups I'd like to talk about. The first one is Joe's House. Joe's House has locations around the country, and they also offer lodging for people with cancer and their loved ones. So take a look for those on the internet. And the last one is the Air Care Alliance. The Air Care Alliance will provide flight assistance for people who have to travel a long way to get their care. At the federal level, the FMLA Act, or the Family and Medical Leave Act, is a federal law that protects your job if you work in a large enough organization while you're getting medical care or taking care of somebody in your family or in your circle of friends. At the state level, there's also state level disability and also state assistance programs. That varies state to state. So depending on the resources and frankly the politics of that state, you will find that those resources are variable, but reaching out to your health department is a way to find out what's available to you. I've covered a lot in this video. It's not really a happy video. I want you to know we see you. We know about this problem. We know about the costs of care. They're highly variable, so that's why we haven't given specific information. And no matter where you live in the world, reaching out for resources and finding out what's available through your cancer center, your doctor's office, the local hospital or local nonprofits, as well as your state and at the federal level can help cushion some of the blow from financial toxicity. Thank you for watching, and we'll see you next time.